I'm Keith Kamhai, the Managing Director of the Techstars Healthcare Powered by Permanente Medicine Mid-Atlantic States Accelerator, and we're based in Washington, D.C. And I'm joined by three phenomenal panelists who are thought leaders in their space from Permanente Medicine, and they're going to be discussing trends in healthcare and more broadly how innovative startups can play a role in transforming care delivery overall, and then specifically within their fields of specialty and specifically within the Permanente medicine system. Before we jump into introductions of them and the questions, I'll ask them to tee things up. A brief introduction of the program, and I'll do this in just one slide. There's a lot more information again on our website. But the program is for visionary entrepreneurs who are meaningfully transforming healthcare delivery, making it more accessible, personalized, and efficient. And we're looking for solutions that could thrive in a value-based care environment to enhance outcomes, reduce costs, and improve care experiences across a diverse set of populations. There's a bunch of information drilling down through our webpage. You can get to our webpage just by searching Techstars Permanente. It'll be likely the first link there, or through the URL over here. Among the many things that you'll find links to are additional recordings of a overview of the program and an AMA that we did last month, along with another thought leader panel, details of our $220,000 investment on improved terms that we're now giving starting this fall. So this will be the first class of founders who has access to these improved deal terms. We get a lot of questions that come in about whether or not your company could be a fit for the program. Broadly speaking, if you're impacting care delivery and it could be relevant to a value-based care system, broadly speaking, it probably is a fit. If you're looking for whether or not the specialty that you're working on is a fit within Permanente Medicine Mid-Atlantic States system, there's a link to their specialties and institutes. Basically, if you find something that seems to align with something that you can add value to, it probably, again, would be a fit. There's a link to our LinkedIn page where we post updates, including things like upcoming panels and other information. We have a panel again tomorrow morning. If you want to register for that one, there's a link on the page. And finally, and very importantly, the Apply Now button. Applications are due next week, so we encourage you to do that if you haven't already, and get that into us. It doesn't take too long, but we do value a good application, so put some thought into that. With that, I won't spend a lot more time on that because there's a lot more information out there, but why don't we jump in and get some introduction of our terrific panelists? And if I could, maybe I could start with Amaya to go ahead and introduce yourself.
Sure. Thanks so much for having me on this panel. My name is Amaya Kulkarni. I'm an interventional cardiologist by practice. I'm also one of our associate medical directors. I lead a bunch of parts of our practice, including medical specialties, operational excellence, and emerging market enterprises. The easy way to say that is all of our ventures and partnerships and opportunities for growth I get to help build on. I'm really excited about sort of how we're going to transform care delivery together. One of the first projects I worked on when I started at MapMG was on building remote monitoring platform for heart failure, and this was like 11 years ago, back before it was cool, I like to say. And we sort of demonstrated utilization benefit in this like little scrappy pilot with a startup, and so this feels like the better version of that project. So I'm excited to work with y'all.
Fantastic. Amy.
Hey, thank you so much, Keith. Really excited to be part of this panel. I'm an OBGYN physician, so I'm thrilled to see, just scrolling through the chat, tons of OBGYN related great potential innovations out there. So it's super exciting. I've been in practice since the days of paper charts. So it is truly exciting to see like how rapidly things are changing in terms of innovations, advancements. I think with that also comes a lot of challenge. Super excited to collaborate with you. I am also the associate medical director for our women's and maternal child health programs throughout the region. And, again, there's a ton of opportunity there, especially, the one thing that is most near and dear to my heart is maternal health. We have some amazing programs in place already, but I think this is an area that's really ripe for continued innovation and transformation. So excited about all the opportunities ahead.
Fantastic. And Raul, round us out.
Thanks, Keith. Super excited to be here. And thanks for everyone who joined for giving us your time and really contributing to this. We hope that we can really make some great work together. I'm Rahul Tivar. I'm a general surgeon. I've only been here at MapMD for 16 years. I'm like the junior guy. And I'm our regional medical director for perioperative services, so all of surgical services and strategy across our region. I also run our robotic program and our surgical quality program.
Fabulous. All right. I'm going to take the slides down in a second and jump into some Q&A just by way of very brief background, because there's more about me on the website and in past panel, but I've been a founder for most of my career, generally of and related to the health tech space. And so spent several decades doing that. And for the last 10 years or so, I've been investing in and supporting startups, the last 7 of which have been at Techstars. And this program is truly phenomenal because you're going to get not only the support that Techstars provides, which I think is very special, and it made me want to come back to go work at someone else's company. I thought I gave that up in my 20s after I started founding companies for the rest of my career, but I think Techstars is an extraordinary platform for helping founders. When we do it in partnership in a vertical with an organization like Permanente Medicine, and if you are a healthcare founder, the opportunity to get support from 2 organizations instead of 1 essentially doubles the benefit and greatly extends the opportunity that you can get out of a program, including what I think you'll hear a little bit about is how they hope to engage with companies in the program and have some opportunities even for prospective pilots if you're a good fit for that. So this is a unique and very special program. So with that and that endorsement from me on why I'm spending my time on this, let me take down slides here. All right, so with that, all right, here's run a show. What I'm going to do is I'm going to go through some Q&A with the panelists, some set questions that I think everyone will be broadly interested in, and we'll, kind of directionally where we're headed, just so you know, is I'll ask each of the panelists about sort of current opportunities for innovation within the space that they're seeing broadly and within their own area. Then we'll look backwards and get a view of some things that they've done with innovative technology in the past. Then we'll go forward looking and break out the crystal balls and predict where healthcare is going to be 5-10 years from now in each area, and how innovation can help with that. And then specifically and tactically on how they might hope to engage with founders who are lucky enough to get into this program. We'll then switch over to audience questions. And again, if you weren't here right at the beginning, the way to get a question in for them to answer is to use the Q&A button at the bottom of the screen. So it should be right under our faces next to the chat. If you don't see it there, then use the More button to get to the Q&A link, because it could be hidden if your screen's not wide enough. Drop a question in there. Before you ask a question, though, I'd encourage you to look if someone's already asked something similar and voted up instead, because Jessica Locke will come on a little bit later to moderate that Q&A. We'll go by the sequence of what seems most pressing to most people. So with that preamble and that background in mind, why don't we jump into some questions for the panelists? And again, let's start with current opportunities, examples of current challenges and resulting opportunities for innovation within each of your specialties. And we build a program, again, as being designed for the visionary entrepreneurs who are meaningfully transforming healthcare delivery to make it more accessible, personalized, and efficient. And that we're seeking solutions that can thrive in value-based care and enhance patient outcomes, reduce costs, improve care experiences across diverse populations. So with all that in mind, what are some examples of current problems that you're seeing resulting in opportunities for innovation within your field? And Amaya, maybe we can go to you first.
Yeah, sure. So I think that there's sort of 3 buckets that I think of when it comes to challenges that medical specialties face. And so bucket 1 is administrative burden. So I think everyone is facing the administrative burden, but a physician's goal is to spend as much time as they can with patients, and all the things that take us away from the patient's bedside, I think, are sort of pain points for us. And so the more we can sort of focus energy on the patient, I think that the better off they are. The second category really is, what are the things we can do to help patients navigate through healthcare systems? What are the tools that we can help with, either patient navigation or social determinants of health, so that there are tools like, I'm a cardiologist, a patient with heart failure. Some of their problem is medication management, and some of their problem is that they can't afford the food they need to eat, or they live by themselves, and so they don't have social supports to identify when they're getting sick. So that's really the second tool. First tool is administrative. Second tool is community based issues. And then the third tool is like, what are the things we can do to really help patients live longer? And these are sort of the predictive analytics tools, the things we can really use to help understand disease at the earliest stage, so we can modify it.
Great. Amy, how about you?
Yeah, and really building on what Amaya was saying, I think the other thing just sort of overlying all of this that's really important to all of us is, how do we reduce some of the disparities that we're seeing in health outcomes? And I would say that that's kind of a foundational tenet, at least for anything that I'm working on, is I want to make sure that a solution that we come up with for any of our patients is kind of broadly applicable to the really broad diversity of patients that we take care of here at MapMG. I think for maternal health, we all know, right? It's been in the headlines for the past year or two, the significant disparities that we see in maternal morbidity and mortality. Some other really important areas, I think, that are becoming more of a focus, justifiably, because I think they've been sort of left out of the spotlight for too long. Women struggling with perimenopause, menopausal issues, how that impacts aging, how that impacts the workplace. Those are really important topics to tackle. Infertility, another one. I think it's the experience is very difficult for patients to navigate. So really looking for solutions that really help support women on that entire journey. With infertility, we know that's, takes its toll financially, emotionally, and physically. Some other areas I think that are really important: perinatal mental health, particularly postpartum mental health, postpartum health in general. I feel like pregnancy is a time that patients are probably the most engaged they will ever be in their own care. And they're really focused on taking care of themselves so they can have a healthy baby. And then kind of postpartum, things can fall apart a little bit, and life gets really busy and people start to ignore their own mental and physical health. So I think building additional tools to help women postpartum and really get set up for a healthy next pregnancy or whatever else is happening in life. So those are just kind of some of the areas that I'm really interested in focusing on.
Perfect. And Rahul.
Thanks, Keith. And similar to what Amy and Amaya said, a lot of what we look forward to in the future is continuing to work on improving surgical care and improve it in a way that makes it more personalized, whether that's tools to help clinicians get the right information to their patients, get the right preoperative information to their patients. There's also a lot of innovation in the surgical space about surgical technique, robotics and AI in surgery, augmented reality, and efforts to make surgery faster, more precise, less blood loss, less invasive. One thing I'd say we're looking for a little bit is to focus not just on laparoscopic and robotic surgery, because there's a pre-existing set, but how can we make efficiencies in the rest of surgery, open surgery, knee replacement surgery, et cetera. And then, shifting away from just the operating room, surgical services really encompasses a whole patient journey. So how do we look from a system perspective on making sure patients are in the right venue for surgery, right? That we're not doing outpatient surgery in the hospital, that we're not doing office surgery in the ambulatory center, that we're really getting patients to the right venue for surgery. And then touching back on one thing that Maya said, you mentioned predictive analytics. How can we use that to predict who's a high-risk patient, right? And where they should have surgery to have the best outcome? And conversely, how can we predict who's going to have poor outcomes after surgery, who's going to have complications, who's going to have outcomes that can be prevented, and then work with them to prevent that. Specifically, we're working a lot in our elderly population. As our elderly population grows, how can we really provide the best care, the highest value care, and the best outcomes for our most vulnerable patients?
All right, fantastic. So that's a nice broad scope of things that hopefully some of the folks on the call are going, oh, I'm working on something related to that. So hopefully this is some inspiration to get the applications over the finish line and some motivation for that. But let's now turn, and maybe we can go in the same order, and just looking back a little bit, just so they can get a preview of, okay, so if I'm fortunate enough to get into the program, I'm working on something in one of these areas, I get to work with one of you on it. What are some examples that you might be able to draw from the past of innovations that you have successfully implemented? And what was the process that you went through to get it from maybe an early stage to working within your practice? And are there any lessons learned that you would suggest to founders, again, and this is transferable whether or not they're in the program, but to get to work with a big health system like yourselves and actually get an innovation from concept or their early MVP into active utilization? So maybe if you can each draw from some example that you've seen or been part of within your practice, and we'll just go back in the same order with the name.
Yeah, sure. So I'll tell you, I mentioned at the beginning the heart failure remote monitoring project, which we did 11 years ago. I think that's a great example of sort of co-development to completion. You know, we worked with a vendor from the beginning and talked through what our unique challenges are as a value-based care organization, and what we needed to do to best take care of patients. And I think what that allowed us to do is really hone in on the problems that we wanted to solve with this technology. So it wasn't sort of a shiny object problem, but it really was focusing on, well, what do we need to better take care of patients? In that case, it was getting information quickly. And then what don't we need? Like, we didn't need all the bells and whistles, the fancy tools. We just needed a vehicle to get information quickly. So I think that was an example of a vendor really listening to us, and a startup sort of working from development to completion. And that's a program that not only a version of that we still use in our heart failure program here, but it became the basis for the national platform, for Kaiser's national platform on heart failure management. So I think that's a real opportunity to sort of co-develop from the beginning. We sort of just a counterexample to that. So Amy and I worked on a postpartum support group program, and it was like, we thought it was a great idea, and we developed it very very thoughtfully, and then no one showed up. And so what that taught us was that even the best of ideas can sometimes have poor product market fit, and that's something that we don't always know either, because sometimes there's an idea that works some places and not others. And so I think the willingness to sort of pivot and try. We're trying again in a third different iteration now for that postpartum support group. So that's always a good lesson to remember. So.
Great example. And one of the things we encourage in the program is getting those learning cycles quickly. So you don't want to spend 6 months down a path that's not going to work. You want to spend like a week on it. So how do you learn that and move on to the next thing? Hey, Amy.
Yeah, so I think one thing that really came out of COVID was, how can we better provide prenatal care virtually, right? No one's ever done this before. We were suddenly, with no warning, in a situation we were shutting down centers. We didn't have the ability to provide the same amount of in-person care. But for someone who's pregnant, there was nothing out there, right, that could really assure us that we could still provide the same level of care in a virtual venue. So we sort of stumbled through a little bit during COVID of like, well, there's like 2 visits that you don't really need to see the person, in person, because you don't need an ultrasound, you don't need a blood test at these particular visits. And we started kind of looking at it that way, right? And then sort of out of that, we thought, well, what do we really need to be able to provide the same level of care virtually that we can provide in person? We need some devices. We need our patients to have a blood pressure cuff and a weight scale and a fetal Doppler. And so then, we developed that, and we have Bluetooth enabled blood pressure cuffs and weight scales that we can, patients can have their data, integrated into our electronic record. And I can be on a video camera with my patient who's sitting on the couch at home with her husband and her toddler and her dog, and they're doing, like I get to meet the whole family and the pets. And we have this like lovely virtual experience, and I feel comfortable as a physician that I can still provide that same level of care. And I would say it's been overall really successful, but not for as broad of a population as we expected. So we've learned that like now that patients don't have restrictions, they can come in for care. Most first-time moms really want their care in person, but second pregnancy, third pregnancy, again, life is busy. You've got other kids at home. Wow, it's really convenient not to have to come in for those appointments. So we sort of have learned along the way sort of how to better target the program to the right population. And again, I think, we keep sort of iterating and keep improving on it. There's tons of lessons learned, I think, with any of these. And I think really being, starting with like a small test of change and learning quickly and pivoting quickly, admitting when things aren't going down the right path and shifting. I think those are really all important things. I feel like at MapMG, we sort of have this innovative spirit, and, we are, all about learning quickly from our mistakes and moving on.
Perfect. No.
I probably should come off mute. Thanks, Keith. Yeah, I mean, and I echo that MapMG, we have an innovative spirit, and also what we look for is kind of taking advantage of our structure, which is of an integrated healthcare system, right? Which is and everything's in-house. And for that, I think about when we started our NSQIP, our surgical quality program, and we realized that it's difficult to interpret surgical notes and people's documentation across various settings. And we were able to actually just go ahead and standardize that if you do a hernia, this is the note you're going to use. And it contains like a standardized format, smart data elements embedded in the note, so we can just quickly and rapidly pull out the data we need without having to read across a varied set of platforms. And it's all one EMR across our whole region. So it really enabled us to move quickly and really drive standardization in a way that I think would be difficult in a lot of other healthcare settings that are not quite so integrated and tightly reliant on each other. And I know the other thing that came to mind, I know it's been discussed in some of the other AMAs, is ambient listening, and how we've really really invested in that to ease the daily burden for our providers and really enable a clinician to sit in a room and talk to a patient, look them in the eyes, and engage with them on a personal level, knowing that this AI-enabled platform on their smartphone is listening and writing the note and creating documentation that then they can see that population note eases their day, really creates a better work-life balance for the physician. And also the patients can see that on the back end, right? We have open notes. Patients can see everything we write about them, and they can see this is what I said, and this is exactly, this is very accurate. And we've seen it increase the accuracy of what we've done. A lot of engagement and work with the vendor and the startup that started that company to help adapt it to our needs and us giving feedback to them. I think that was an important part of the relationship.
Phenomenal. All right. So so we kind of hit some current opportunities in a few of the specialties, some pathways from the past on what that might look like to engage. Let's now go forward looking and break out your crystal balls, combining the trends you're seeing in technology, what you're seeing in medicine, the problems you're seeing, and look out, whether it's 5 years, 10 years, and we will save the recording that long to see how you did. But give some predictions on where we're gonna be in each of your respective fields, and how can you imagine healthcare being transformed for the better? How could you see founders playing a role in driving that? And then maybe if you could also touch on what makes MapMG well positioned to remain on the cutting edge of this sort of transformation. And maybe why don't we start again with Amaya and just kind of keep going in that sequence here.
Right on. So I think that, and you'll definitely hold me to this, I think the next 10 years, I expect to see a couple of things. So one, I think we're going to start to see more and more care shifted to the home. I think that the trend we've seen over the last 10 years is people are tired of hospitals. Hospitals are dangerous places to get care, as everyone likes to say. And so I think that the more we can see care safely transition to the home, I think the better patients will experience their care. So I think we'll start to see remote technology being used to better care for patients in the home. In particular for chronic disease management, you think of like diabetes or heart failure or COPD, where these are chronic diseases that have specific, points where the disease becomes acute. These kinds of sort of home-based care delivery tools are going to be very, very useful. So I think that's one thing. I think the second thing that we'll see is that I like to say tools that are going to make humans feel more human. So we have a massive aging population. Aging population will have medical needs, like some of the conditions I mentioned, and then will be less mobile than they have been in the 10 years before. And so we'll need to enable caregivers, not just their family members, but caregivers in the community, their neighbors, or to be able to create a community of support around people who are getting sick. So I think we'll start to see technologies move in that direction. And then the third is I think we'll start to see some automation of this sort of the lower, let's call the lower cognitive function tasks, especially with I think AI and agentic technology. We're going to start to see a lot of those inferences come from the machine that then the humans can process. And the thing, I read EKGs all day as a cardiologist, and the ability to sort of more simplify that process so that I can use my cognitive load on the things that are most risky to a patient. I think that that's a real, that's what I see.
Perfect. Amy.
And yeah, even kind of like taking what Amaya said further in terms of bringing the care into the home, putting the care decisions back in the hands of the patient, more self-directed care options, and we're already starting to see some of this self-testing. But how do we really do that in a way that it is very much evidence-based and still guides the patient, right, to what decisions make the most sense, but really ultimately allows them to take control over their testing, over their treatment. Where along that path, though, do we need the physician engaged, right? And sort of figuring out how that all, how that whole continuum works, I think is going to be really important. And I think really predictive analytics, I think Rahul, you touched on this a little bit, but like we need to figure out which patients are going to have a complication, which patients do we need to be seeing more frequently. Right now, prenatal care, for instance, is kind of one size fits all in terms of our cadence of visits. Probably not everybody needs that many visits. Probably some people need more frequent visits or more monitoring or more testing. And how can we make those predictions early on? And then really map out an individualized, personalized care journey for that patient. Same for menopause, perimenopause. I mean, I saw 3 perimenopausal patients back to back yesterday. They all had completely different concerns, completely different symptoms. Probably they will all have a very different timeline and journey. It would be really lovely to have some tools up front to at least be able to counsel them about what to expect and what may be the best treatment options at this point. And again, sort of laying out what that journey may look like based on better predictive analytics. And I think we can probably say the same when it comes to infertility, rather than sort of like a try and fail approach. In some cases, really figuring out, well, who is it that needs to go straight to in vitro fertilization and don't mess around with anything. We have some of that, but I think that is also a space that's really ripe for innovation and improvement.
Really? Cool.
And I think, when we look that far in the future, I think it gets fuzzier the further you go out. But I do think that we want to see the predictive analytics is a little bit, it's can be a little bit removed from the fast pace with which we have to provide care sometimes. And I think as we move forward, we're going to start seeing more decision support tools that build into our acute care, our critical care, and our really timely services. So instead of relying on me to put the pieces together, something, right now it'll say, oh, this patient meets service criteria, but I want it to tell me, hey, this patient is septic and it's probably their bowel, right? And you need to go to the OR right now. And then when I get in the OR, it's going to be me looking at it to say, this piece of bowel is dead. We need to remove it. And I think as we get further out, we're going to see more automation as well, where you really don't need me there to do the manual work. You need me there to do the judgment, to say this piece of bowel is dead, remove it, and machine remove this piece of bowel and put the ends together. And it's going to do it. I'm very good, but it's going to do it faster and more accurately than I can. And I think that's where we really want to see the future headed. Surgeons don't like it because machines are going to take our jobs, but they're going to do it better. And as long as patient care improves and it enhances the value we're providing to patients, I think that is a plus for everyone.
Extraordinary. Okay, this is so. I'm going to ask one more question to the panelists, and then we're going to go to your questions. So one more plug to drop your questions in the Q&A section. And I mentioned this at the beginning, but I've been here for 7 years. I used to manage all our programs globally, so I've gotten to see all our different partnerships, and then I've run programs with Melinda Gates's fund, Pivotal Ventures, with JP Morgan, with an impact fund in New York, Samba Ventures. This is unique. I mean, you're hearing from people who are daily practicing in the area of where your solutions are aiming, who are your customer, your user, your collaborator for what you're trying to do as the partner in the program. You get so I'm getting excited about this, and I'm not even a founder who's considering this. So this is a kind of unique opportunity again to get the combination of what Techstars brings in general to all our programs, combined with if you're hearing something that relates to your field, this is unique. So I want to ask this last question about what that engagement might look like, and I'll ask you each a little different twist on the same thing. But maybe Raul, we could start with you on this. And how would you hope to engage with a company that got accepted into the accelerator if they're within your field and it's something that you could see you could see working on, whether it's impacting that future you're describing or in line with some of the things you've done in the past?
Well, what I hope for in the engagement is to really work closely with someone and rapidly accelerate their solution, right? And accelerate it so it's tailored to the needs of patients and physicians. And you touched on something that is true about our organization, is that all of our leadership in our medical group practices medicine. There is no carve out for suits who don't, like all of our suits wear scrubs. So we're all practicing physicians, and we really want to bring that to help hone the solutions. And, the other thing we see, we think we have a pretty unique value-based care, like a true value-based care system. And when that value aligns with our partners, with whoever we're working with, I think then innovation really thrives, right? And if companies can prove to us that they can bring value to our integrated delivery system, then we know that they can bring value anywhere. So really, we want to work with them, rapidly show, is this valuable? Can this bring value to patients, physicians, providers, and improve our outcomes? And we're not looking to improve our revenue. We're looking to improve the outcomes. And I think that's the core of what we do and how we're going to work together to show whether something has potential.
Terrific. Okay, and Amy, just building on that, how does Permanente Medicine's unique approach to delivering value-based care make for a good environment for startups to validate and refine their solutions, as opposed to the more prevalent fee-for-service models?
Right. Yeah. So I think two things. I mean, the fact that we are integrated, multi-specialty, and have multiple venues and a very diverse population kind of gives you access to all of it. So that's unique. I think in terms of being value-based versus fee-for-service, it allows us to innovate without having to worry about the fact that, oh, well, I can't bill for that. Or, in the fee-for-service world, it's like, well, if I, am I willing to go out on a limb and try something new for a service I can't bill for. And, and part of what brought me to Permanente, coming from a fee-for-service world, was it was very frustrating to have to change my practice based on how I bill for the care, right? Like we don't have to worry about that. And fee-for-service, I would have to, if someone was coming in for a well woman visit, but also needed something else, a procedure, actually would have to bring her back for another visit, right? Like that's not good for our patients. That's not good for our access. Being in a true value-based clinical setting gives us a lot more freedom to do what is best for the patient and what's more efficient. So I think that really is something that's unique and makes us a great place to come and innovate with.
Fantastic. And Amay, I'll have you round out, and then just warning Jessica that you'll be coming on stage in just a moment to moderate our questions from the audience. But Amay, if I can ask, what does it take to successfully land a POC or pilot? So if an aspiring founder joins the program and they're hoping to have that happen, what does it take to do that and ultimately land the contract after that? With a major health system like MapMG, and what are the critical components, the value impact now and in the future of that? And you also touched on earlier, maybe you can expand on, you mentioned one solution that not only succeeded here first, but then rolled out more broadly within Kaiser Permanente. So maybe you can touch on that as well, and then we'll get to some audience questions.
Yeah, sure. So I think that if you want to understand what works in MapMG or Kaiser Permanente in general, I think the basis of our ethos for how we drive care is what we call our value equation. And it looks like value equations you've seen everywhere else. You put clinical quality and patient and physician experience in the numerator and cost in the denominator. And you have to solve that equation in a positive way to succeed at Kaiser Permanente. And I would actually say in the world we are in now, you actually have to solve that equation if you want to succeed anywhere with healthcare. And so the order of what's important to us matters in that. So we always start with quality of care delivered. If it's not a thing that it's improving the quality of the patient experiences of care, it's probably not something we are interested in, and also that the patient's experience is enhanced by the product. So I think if it's meeting those two things and it's thoughtful about the premium dollar. Now, I want to be clear, that doesn't mean that we don't want to do things that cost more money. We are happy to spend more money on things that have value, but we really care about those things that add the most value for our patients. And so, and if you just take that as sort of the basis of thinking about whether you're doing a proof of concept or whether you're doing a pilot or whether you're looking for a contract with MapMG or whether we do something great here and it scales, even when we are trying to convince our colleagues in the other regions to adopt something, we're using the value equation as the basis of that. So I think if you use that sort of as the thought, as a sort of how you're thinking about where your product fits, I think that'll get you far.
Perfect. All right. Well, thank you. And Jessica, why don't we get you spotlit here as well? And terrific. And I'll pass over the moderator chair to you to take us through some audience questions.
Great. Thank you so much, Keith. And thank you to my esteemed colleagues for the thoughtful discussion thus far. So again, as Keith mentioned, we'd like to open the floor now for your questions. And we've seen a lot of really great questions come through the chat so far. And we'll try to address as many of them as possible with the time that we have remaining in this discussion. So we're going to first address maybe some women's health pediatric questions. Amy first. So the first question is pediatrics an area you are also considering in addition to maternal health? Any challenges you are looking to tackle in the early childhood health space?
Sure, yes, absolutely pediatrics. We are definitely interested in looking at solutions in this space. I would say, the big challenges, right, for early childhood development and health really are around the increasing obesity epidemic, which is really setting people up for lifelong health challenges. you know, getting children back to healthier behaviors in general, right? Healthy diet, healthy amount of exercise, reduced screen time, really getting kids engaged in health and health literacy early on. There's so much information out there. We need to be able to like teach our children early on how to get the right information, right? It can be pretty overwhelming. So again, as we're kind of focusing on putting decisions and putting really individualizing care more, I think engaging kids in their own care is going to be really critical, and kind of, you know, getting them to sort of understand that, you know, decisions, behaviors, things that are happening now really do impact them lifelong, and anything we can do to, you know, to really increase, you know, their understanding of their own healthcare, their engagement in their own healthcare, is, I think, going to be a great solution.
Great. So Amy, you talked a lot about some of the opportunities in women's health. Are there any additional gaps or opportunities that we have that you could just share with the group?
Yeah, I think there's you know, a couple of other topics that I haven't touched on before, but I believe there are a few people in the chat who have some potential solutions. But I do think other chronic gynecologic conditions like endometriosis, other chronic pain conditions, I think are areas that are really ripe for innovation. I think, and Rahul touched a little bit on, you know, some of the surgical aspects, but really kind of accelerating the minimally invasive surgery that can be done, you know, in the office setting or even an outpatient surgery setting and not in the hospital, reducing recovery times. I think there's still innovation in that space. Again, kind of self-testing. We're seeing some innovation there, but I think particularly in women's health, there, you know, there's definitely opportunity there. Did I answer that question, Jessica?
Yes,
Was
that
there a
was
part
great.
two?
No, that was
All right.
perfect. Last question related to women's health. So I think, you know, Amaya, Rahul, and Amy, you all touched upon, you know, aging population, shrinking medical staff. So are you seeing a reduction in OBGYN specialists? And what thoughts do you have on clinical practice changes that can utilize the physician most efficiently?
Yeah. So yeah, definitely some challenges in terms of access to specialists across the country. I think there are some good opportunities, and I'll give just one simple example. So within the field of urogynecology, there really aren't enough urogynecologists you know, in practice, right, to take care of the needs of all of our patients, especially with an aging population and aging demographic. But a lot of what patients need in that perspective is, for instance, like physical therapy, and things that they can do really without having to see a specialist, to help with issues like incontinence. So I think really that's a great area to focus on for innovation. We're starting to see a little bit of that, but I think there's a way that we can really sort of extend the reach, right, by innovating and putting care in the hands of the patients, a lot of which they can, you know, do at home. We can come up with a pelvic floor physical therapy program with biofeedback devices, right, that they can do at home without the need of a clinician to do more than just sort of like touch base periodically and guide them along the way. And I think, you know, you can extrapolate that out into multiple different areas.
Great, thank you, Amy. So Amaya, you touched on this during your remarks, but could you talk about how tech solutions need to have a fit into Kaiser Permanente's value-based model in the past? And then in addition to that, can you talk about just our model and how we really look at innovations, not only for our region, in Mid-Atlantic, but also for the Kaiser Permanente enterprise as well?
Yeah, so I think that this comes to the value equation that I was mentioning. You know, I think that we look at quality of care, patient experience, physician experience, and cost, and that's really how that is our value-based care model. And so we look through new technologies from that lens. In terms of how we think about emerging technologies, I think we apply the same lens, but are willing to accept a little bit more uncertainty about one of the components. Like, for example, if there's a new medication or a new device, there may be only a little bit of information about the value in terms of quality of care delivered or price. And so in those cases, we have a panel of experts across the country that sort of look at these new technologies together and make a determination about whether it's something that we think we should be leading on or whether more information needs to be given. And a classic example I give is about SGLT2 inhibitors, the treatment for diabetes that also assists with weight loss and has been shown to reduce mortality in a bunch of different spaces. When we read the initial papers, there wasn't widespread acknowledgement yet about the transformative value of that medication. But as a team of cardiologists across the country, we said, this is something we think our patients need. And so we were probably one of the first health systems in the country to adopt that as part of like routine care for heart failure. So that's an example of a place where we saw the data. We said that seems to be value here, so we're going to accept that we're probably early on the curve. And then there's other times where the data seems uncertain, and we sort of say, let's wait and see. So I think that it's sort of we always start with experts, and so we're going to say, if there is a particular tool, device, technology, or medication that has potential value for our patients, we're going to ask the experts first to evaluate it and then use that expertise to understand how we're going to implement it or what we're going to wait for to decide whether it makes sense or not.
Great. And that was a really good segue to the next question. So Rahul, does KP purchase best-in-class new medical technologies differently than other hospitals or health systems that follow CPT codes and generally purchase the lowest price device that meets AMA minimal requirements for a procedure?
Thanks, Jessica. It's a great question. I think there are many ways in which we're similar in that we leverage our national footprint to negotiate with vendors at really large scale and really try to get the best prices for our members to keep costs down for our members and keep membership prices down. However, those decisions are made by our National Product Council and all of its subsidiary organizations and subcommittees that are driven by value and clinical outcomes. And so we really rigorously look at the clinical value of products. And there are plenty of cases where we've looked at it and decided to spend way more than a separate product that has, we don't actually look at the reimbursement. It doesn't matter to us. And so we've definitely gone with the more expensive product before when it has better clinical value. I'll say, we picked a glove manufacturer because we like their environmental practices, and they source their natural rubber from sustainable places around the world, in Malaysia, et cetera. So there's a lot that goes into it, and certainly the reimbursement is not a consideration. So I think in many ways it's the same. We really leverage our national scale to get great product pricing, but we look at it through our own lens, which is very unique.
Great, thank you. So one of the questions that came through the chat is just around how do we envision the partnership, which I think the panelists really answer that question already quite well. But I just wanted to just answer an additional question that was asked, which is, will the 3 months of the program be sufficient to work in a pilot, or do you expect to continue to work with the companies afterward? Again, as the panelists had said, I think we're being really intentional, right, about casting a really wide net for this first class. And then as we're reviewing the applications, we're keeping in mind that we want to pilot or have a POC with one or all of the companies that are included in this program. So we're being really intentional as we're reviewing the applications to see, as Amaya and the panelists have said, right, does this fit within our value equation? Does this fit within our strategic initiatives and imperatives that we have now, 5 to 10 years from now? And then hopefully during the 3 months, a pilot or POC will materialize. But if it doesn't, that's okay, because we're going to follow you through this journey, right? And after the program, we'll continue to work with you, and hopefully in the future, that will come to pass. So the next question is, and I think you've already answered this several times now. Anything else you'd like to add about the key criteria or milestones a company needs to reach before partnership discussions begin?
Yeah, so I think we're looking for the whole spectrum of companies that's, probably not pre-seed for the most part. Think of in terms of like a commercial partnership, but once you've demonstrated product market fit, and actually we hope that this potentially is a way you could, this accelerator is a way you could demonstrate product market fit. Then from that point onward, we are happy to engage in any stage of conversation. We like co-developing because I think it allows us to have some input as to what the final product looks like. I think what we have historically found, like 10, 20 years ago, was that a lot of the technology in the marketplace was designed for a fee-for-service world. And so the ability to sort of design based on value for patients is something that we care a lot about. So, but really any stage from fully mature to, we have some pre-seed engagements. I'm not saying we never do it, but I think that because that's a longer horizon, we're much more intentional about who we choose for those. So.
Great. Keith, what is our process for down selecting applicants to determine the cohort?
Yeah, so we'll read the applications first. So please do answer, concisely and directly in your application what you're working on. Don't be evasive. It's good to be clear. Your short videos are very helpful as well. Keep them short. That lets you talk to us about who the founding team is and then yourself. About 80, maybe up to 100 companies will get a brief interview. We'll then down select about half of those to get onto a second interview and half of those to come to the screening committee, where we'll have a panel of both Techstars and Permanente Medicine leadership to make a final determination of the 10 companies that get into the class. So it'll be a rapid succession of follow-up discussions.
Great, thank you. So we have just 4 more minutes left.
And just to go real quick, I saw a question in the chat as well about applying to Techstars program. You can apply to up to 2 Techstars programs in your application. It is very important, however, to note the primary program that you're most interested in. We will tend to look at the primary ones first, because that's indicating that if you were to get in, you're most likely to join. So do be intentional about what you're picking as primary as well. So sorry.
Great, thanks. So Amaya, back to you on this question. Thanks for the great discussion today. A KP Mass alumni here, great experience. Since KP is essentially a closed network, is there any thinking about offering a preview or taste of MapMG's value-based healthcare through centers of excellence before employees have to choose a health plan benefit, or customers have to choose a health plan benefit? I feel like this was like a planned question.
So a passion project, that's why.
Yeah, a passion project. So could you answer and specifically how kind of that relates to like startups and innovation and just our growth within Mid-Atlantic?
Yeah, I think that I don't think it's any secret that our goal as Permanente Medicine is to share our brand of medicine with the world, and so any way we can do that sort of stays true to our core values is something we care a lot about. And that may mean offering sort of carve-outs of care for specific conditions. We want to be thoughtful about what those carve-outs of care are. Like, the classic centers of excellence center on developing deep expertise in the single point of care. Our expertise is really on comprehensive integrated care. And so we want to focus on places where comprehensive integrated care are value if we're going to offer those to patients who are not Kaiser Permanente members. And so things like chronic disease management, that's a really great example. Or in musculoskeletal medicine, there probably is a, like hip replacements where we can offer rapid return to function, where there's value in the integration. I think that's places where we want to think about engaging. And then our virtual urgent care program is a really fabulous way to learn about how we offer rapid integrated care. So in terms of how startups can help think about those unique deployments, I think that if your product is in a specific area and you think there's a broader you think there's a broad audience or a vehicle for us to expose that technology to a broad audience, we want to have that conversation as long as it's sort of consistent with our core values. I think that's sort of we still care about comprehensive integrated care. So I hope that answers the question.
It does.
And thank
Thank
you
you
for
so
asking that. That's my favorite question.
So we only have a minute left. So again, I just want to thank you again to my esteemed colleagues in the panel to hear today. It's really been quite informative. Hopefully it was for our startups here that joined us. So I'll turn it back over to Keith to just close this out.
Yeah, I echo that. Thank you to the panelists. This has been extraordinary. It gets me even more excited about doing the program. I've been here for a long time, so hopefully the founders out there are hearing some things that you can build on and some problems that you can solve. Again, I encourage you to take a look at the webpage for a lot more information, links. Some of the questions that I saw in there might have been answered in some of the other panels or AMA that we've had previously are out on that page. And you can get in touch with us through the LinkedIn page as well. So with that, thank you for joining us. We hope you'll apply. Apps are due mid next week, so go ahead and look at that. And thanks again.